recording this portion of the meeting. Is that okay with everyone?
Sure.
Okay. And then Stephanie, is it all right if we have Christy post your slides and advance them for you, or would you like to share your screen?
Oh, that's fine. Yeah, that would be great.
All right, thank you. I'll give Christy a minute to get that loaded and display them.
Okay, that looks great. Thank you.
Wonderful.
So I'm Stephanie Arnellis. I'll say that again. With the Colorado Consumer Health Initiative, we have a consumer assistance program, and that my job is to manage that. Just for reference, I put my contact information here on the first slide. And so today, I thought you could go to the next slide. We talk a little bit, just a bird's eye view of CCHI, and then a little more about our consumer assistance program. So what we do, and then I thought I'd touch on a couple of issues that that we see an awful lot. So surprise medical bills and people who are needing hospital financial assistance. And then I got a little bit of information on about how to refer to us. So just to jump right in, CCHI, we're a statewide nonpartisan nonprofit organization. We work so that all Coloradans can get affordable, high quality, and equitable health care. We've been around since, well, this is our 20th anniversary this year. So we're excited about that. We were established to be a counterweight to the larger forces in the healthcare system and to be a voice for consumers. And so our vision, it's right there, is equitable access to affordable, quality healthcare for all Coloradans. So over the years, CCHI fielded a number of calls from consumers who were struggling to navigate their healthcare costs, whether it be they were uninsured, or maybe they did have insurance and their insurance wasn't covering the services that they need, or they were getting bills in error. They needed help. And so a couple of years ago, CCHI created this consumer assistance program. We've been funded by the Next 50 initiative, so with a focus, but not an exclusive focus on consumers over the age of 50. And since then, we've been able to help about 800 people navigate their issues and saved about $1.6 million in medical costs. So we're really proud of that. I was hoping for 2 million by May, but maybe we'll get 2 million by, I don't know, December. I don't think that's too optimistic. And so what we do is we help people navigate billing and claims issues. We will advocate with providers on their behalf or insurance carriers. If need be, we will help them submit appeals with your carriers and file complaints with the Division of Insurance, CDPHE, the Attorney General's office, whatever kind of issue or wherever the regulatory authority lies. We'll help people escalate those concerns. And when we also provide referrals to health coverage enrollment assistance and other resources. So we're mostly focused on the private health insurance market, but I talk about it in terms of having kind of a permeable boundary. We do have some knowledge and expertise in Medicaid, and things do sort of shift over into the Medicare side of things from time to time. But for the most part, we'll be focused on people with private health insurance, although we do make a big effort to cultivate relationships with other organizations that could help people navigate more complex Medicare or Medicaid issues. And I want to stop right there and just say, if you have questions, just chime in and ask along the way. Sometimes these Zoom meetings can be hard. You're feeling like I feel like I'm talking into the void. And so I just encourage you to chime in with any questions that you might have. So we see a variety of issues. And what I've learned over the last couple of years is that if you've seen one case, you've seen one case. there are always surprises. I think the first issue that we've seen, I mean, the most recent thing that's kind of flummoxed me is patients who are without their knowledge or without understanding signed up for a credit card to pay for medical services. All of a sudden, a bill has come from a credit card company in the mail for, you know, $100, and they're wondering what the heck is this? And it turns out that when they've been in the provider's office, they've been signed up for a credit card to pay for their medical care. Like I said, it's not something that I've issues with it. It's not something, I haven't seen issues with it before. The last couple of months, it seems to be something that's popping up, and we'll keep an eye on it. So anyway, but we do see, there are a couple of things that happen a lot. And one of those are surprise medical bills or a balance bill. And so, you know, that's what happens is that the patient gets charged the difference between what their insurer is going to pay to an out-of-network provider and what the provider is charging for services. We have additional protections now implemented as of January 1st. Because of the passage of House Bill 1174 last year, it strengthened the protections available to consumers who have Colorado regulated plans. And really what it just means is that providers can't send a balance bill when services are received from an out-of-network provider at an in-network facility. That was a big gap no, I'm sorry. It also means that if somebody receives ER services out of network ER, they can't be balance billed. That ER portion was a gap in regulation, and we're really happy to see that gap was closed up this year. And frankly, it seems to be going really well. We're still helping people navigate through out-of-network issues from last year in 2019 or 2018 dates of service. But so far so good for 2020 dates of service. We really haven't seen this be an issue. One thing that the legislation requires is that the carrier is required to reimburse the provider directly, and it takes the consumer out of the middle of that negotiation, which is also a real improvement. Prior to January 1, a provider could still send a bill to a consumer even if they didn't owe the bill, and consumers, I think, often would pay that, assuming that if they received the bill, they actually owed it. They wouldn't question it. Now that shouldn't be happening or can't happen. And there's also a disclosure requirement so that consumers are supposed to be receiving information about this regulation and the protections that it affords them. So this applies to Colorado regulated plans. Unfortunately, we don't yet have a national solution for the challenges of balance billing. There are other states that have similar protections, but if we're talking about Colorado and a Colorado regulated plan, the clue to know for sure if you have a regulated plan is to look on your insurance card. It will say CODOI on the card somewhere. So that's, you know, when we're screening somebody, that's one of the first things that we'll ask them. So if we go on to the next slide, what do you do if you get a balance bill for a service that you really shouldn't be owing more than your in-network cost sharing for? One is to try to work it out with a provider, because it depends on the provider's office. Some may know and some may not know. So just sharing that information and having a phone call is what we recommend as step one. Certainly the next step, if that doesn't work out, is to submit an appeal to the insurance carrier. And if that's not working out, submitting a complaint to the Division of Insurance. Now, we help people navigate this stuff on a regular basis, and we will help people kind of as little or as much as they need. The goal is to provide, well, the goal is to make the bill go away, but also what's really important to us is to help people have the skills or learn what they need to know how to do this for themselves. And so some people just need a little bit of information and some tips, but there are other clients who, for whatever reason, perhaps they're overwhelmed by, you know, being sick and you've got a big pile of bills. This is the last thing you want to worry about. We will help them make those phone calls to the provider or write the appeal and or submit the complaint to the Division of Insurance. So we're really trying to meet people where they are and give them what they need to be successful as they navigate this stuff. The challenge is that, as I said, this only applies to Colorado regulated plans. It's not going to apply to many other kinds of plans, so self-funded plans in particular. So if somebody's got employer-sponsored coverage in a self-funded plan, these regulations aren't going to apply, and the protections just aren't there. So in that circumstance, the provider really can balance bill. So some strategies around that would be to try to negotiate with a provider, have the client or call with the client to the provider's office to say, you know, look, this happened. And often it happens and people aren't aware that they're seeing an out-of-network provider. For example, if they're having a surgery and the surgical assistant is out of network. That happens a lot. And so if you can try to negotiate with a provider, you know, requesting that, pardon me, either a payment plan or will they accept X number of dollars up front and be done with it, sometimes that can work. It can also work to request a reconsideration by insurance. It wouldn't be an appeal. Let's assume that the insurance has paid the provider, you know, paid the claim appropriately, but what's left over is a lot. Submitting a request to insurance, you know, indicating whatever circumstances were in play at the time for, you know, for example, again, back to the surgical assistant. I didn't know there was going to be a surgical assistant. I had no idea. I couldn't make a conscious decision about what surgical assistant to choose. In that situation, it can be possible that insurance will reconsider and pay more. You can submit a complaint to the insurance if that doesn't pan out. And certainly if it's an employer-sponsored plan, getting HR and the account manager involved can also be a successful strategy. So unfortunately, it's not clear-cut. It can involve a lot of back and forth. And we see by the time people get to us, they can have been dealing with this for quite some time. But we have managed to have some success using a combination of some or all of these strategies. So I'll take a minute there to ask if anybody's got questions about surprise bills.
So how many people are on your staff and how quickly are you able to respond to some of these inquiries or needs for assistance?
Sure. So right now we've got 3 people on staff. And we have 1, 2, 3 volunteers who help us out for about, I don't know, I'd say they are equal to 1 FTE in terms of the time that they're able to share with us. Our goal is to get back with somebody, at least to do an initial intake call within 24 to 48 hours. 24 is better, but 48 is sometimes more realistic. Just to get all of their information. We're pretty up to date. So these cases can take a long time. Sometimes it's pretty easy. Sometimes clients just want some advice and some information. So we will do that. We'll help them devise a plan and walk them through the steps, and then they're on their way. We make a point to follow up with everybody after a certain amount of time. It really depends on what's happening in that case. So for example, if they're doing an appeal, we might say, you know, might check in with them after a week or so to see how they're doing. Do they want some help? We'll send them templates, or maybe we'll draft the appeal for them, whatever it is that they feel like they need. And then we will follow them through that appeal process. So check in after a month or 6 weeks. And then, you know, hopefully it's worked out and everything's fine. But if not, we'll help troubleshoot with them. If a next level appeal needs to go, we'll work with them through that. So it's either, you know, it's as hands-on or hands-off as people want, but I'll just make the point that we are very conscious of following up and so that we know the resolution, that something's been resolved. So you know, cases can take a couple of days, or cases we have a few clients we've been working with for over a year. It just depends on what they need and how complicated their issue is. You know, some clients come in, well, we're also, because of COVID, working remotely, which has made things a little more challenging. But we've done a pretty good job getting our systems down. We will work with people over the phone. We will do three-way calls or Zoom meetings. We can receive documents by securely by uploading things on our website. So we'll ask people to provide us with their bills, their explanation of benefits. We'll get their evidence of coverage and any other documentation related to their issue. The only thing that we're not, that's harder, or is sometimes people would come in with, you know, their shopping bag full of bills and explanation of benefits, and we dump them on the conference table and then just start sorting. So that, unfortunately, we can't do right now. So I feel like that's the only limitation we're dealing with at this point. What else? Surprise bills. Any questions on that?
Want to make one comment. If anybody's on just by phone and they have something they want to say, they can press *6 to unmute.
All right.
Okay, I'll move on to part 2, hospital financial assistance. So often people come to us who are either uninsured or underinsured. Once we determine whether or not this is a bill that they actually owed and did the insurance pay it properly, we're still left with the challenge of figuring out how to pay for the services that they've received. We'll spend a lot of time walking through, screening people for health coverage and payment options. Are they eligible for Medicaid? Are they eligible for CICP? Are there any other programs that might work for them? And one of those could be hospital financial assistance. So all hospitals are required to offer financial assistance to people who are uninsured and earn up to 250% of the poverty level. There are some hospital systems are more generous and offer help up to 400% of the poverty level, and to people who are underinsured as well. And so we'll help people kind of navigate that process. And again, as much or as little help as they need with that, either just giving them information about the program and how to apply, or walking somebody through the whole process by helping them complete the application, gather the documentation that is going to be requested, and then following up and troubleshooting issues on that application. After this call, I've got a meeting with a client who we've been trying to get his hospital financial assistance approved for a couple of months now, and it just seems to be a matter of pushing back on documentation requirements, and trying to hurry the application along. We do see that people can be asked for documentation that's not required for their particular circumstance, and we're also seeing that the process is taking a little longer now. I think in general it takes about 30 days, although there's no various hospital systems policies lay out how long it's going to take, which should be about 30 days, but we're seeing that it's taking longer right now, which I guess is not surprising. So again, I guess the point is, you know, these are finding resources to help people pay for care is something that we do. Hospital financial assistance is one avenue. If they're not eligible, we will help them or make referrals to other programs that might free up some more money in their budget. So we're trying to look at somebody not just from the healthcare lens. I mean, certainly that's our focus and how people get to us. But if we can help them free up some money in their budget to meet to pay what they actually might owe, we'll do that. So, you know, referrals to food assistance or WIC or we help people find low-cost veterinary care, whatever it is that they need that can free up some room in their budget. We will make that referral. So we're trying to really look at somebody's, you know, the full picture of what they need is. How to refer. So there's our phone number. Thank you. We have a dedicated email address that is monitored by our staff and our volunteers. We also have an electronic inquiry. There's a form on our website that people can just fill out with their name, just a little bit of information, and again, we'll circle back. We'll call them back within a day or two to find out what's going on and if we can help them. The next slide is an invitation. So we've developed what we're calling a CAP cohort. We're trying to bring together organizations that touch on this work. It might not be your focus, but clients are coming to you with their bag of bills and they don't know what to do about it, or something got denied, or you know, they got sent to collections. We're trying to bring together organizations to talk, to provide training, to do some case studies, to do some information sharing, and to foster referrals across organizations for our mutual clients. So would like to invite you to attend that. We are meeting every other month. Our next meeting is August 13th from 1 to 2. And if you're interested, please feel free to reach out and I'm happy to add you to our distribution list. Topics we've covered in the past, we've talked about collections, people's rights in the collections process and what to do when a bill gets sent to collections. We've talked about, done kind of a high-level overview of medical billing and coding and learned just how complicated that is. We have talked about, we've talked about the balance billing regulations and steps for helping somebody navigate that. Next meeting, we're gonna talk about mental health parity and pick out a case study or two that relates to that, and take it from there. Get some ideas from people for what other agenda items should be, what they're interested in learning more about.
Very good. Well, that is very helpful information. I don't think many of us may have been aware that that's available, and I understand it's a free service. Is that correct?
Yes, it is. Thanks for asking that. So we are a grant-funded program and a grant-funded organization. We do not charge for our services, and we don't really have any. There are no barriers to entry. If you need some help navigating a bill, you can be of any income, live in any part of the state. We are statewide. We are, I think we're at 37 counties served to date, and are trying to expand into more underserved areas. So we're excited about that. So really, yeah, all you need to do is give us a call or send us an email, and we will call back and see if we can help. And if not, we'll try to get people to the right place.
Wonderful. And then you have the capability to use language services if you have a non-English speaking client?
We do. We have bilingual Spanish and English, and we are investigating a language line. We don't have it in place yet, but we can serve people in Spanish, English, and are working on being better at that.
Very good. So if someone came to you that's not English or Spanish speaking, how might they be managed or assisted?
How would we do that? Often people bring their own interpreter, which, you know, is not ideal. I suppose we would be reaching out to other service organizations and getting some help. Okay.
That sounds reasonable. I would imagine they often do have family or friends.
Yeah. It hasn't been a barrier thus far, but I do recognize it is something that an important area for us to address. We need to expand and get some, the additional capacity.
Yes. Well, very good. Are there any other questions for Stephanie today? Certainly her contact information is here on the screen, and these slides and this recording will be posted on the task force website. But for today, are there questions that you would like to direct to her today?
Hi, this is Carlin. Stephanie, I just emailed you, so thank you very much. I added
Great.
a .org to the end of your email address, so I hope
Oh my
that
gosh,
works.
you're right. Yes, thank you very much. Oversight.
No worries, no worries.
And let's see if I spelled it right. That's good. And this a lot of I's.
Yes, very good. Well, thank you again, Stephanie. You're welcome to stay with us for the rest of the meeting where we talk a little bit more about some business items. But if you need to log off, that's understandable as well.
Well, thanks. I appreciate everybody's time today.
Yes, thank you. Thank you.
Thank you.
All right, let's take a look at the agenda, and it is 3:41, so we've got 20 minutes that we can use to review some of our other items. And as we go forward, the item that is most relevant that we've been working on and would like your input on is our action plan for the task force. Carlin, is there anything else you would like to say about that as Christy gets it up on the screen?
No, we just want to be good stewards of everybody's time and do the best we can to help as many people with cancer in Colorado. So it's a fluid document, but we've worked hard on it and we're proud of it.
Yes, yes. So we certainly invite you as participants and members of this task force to continue to provide feedback and input on the document. If you can scroll up a little bit higher, Christy, to show what our statement is in terms of who we are. We worked on this in our meeting in May, and just wanted to check in and make sure that it still sits well with everyone and feels representative of our group, and is something that is well represents what our goals are as well. So we as the Survivorship and Palliative Task Force are a collection of individuals impacted by cancer, as well as advocates and professionals who provide quality cancer care throughout Colorado. And we provide a valuable collaborative networking platform of comprehensive and diverse perspectives for cancer care delivery within Colorado. Our interdisciplinary group promotes the sharing of resources for patients and caregivers and fosters statewide interaction. Yay, we're glad to hear and see so many people from Pueblo, and professional development. We seek to break down silos and to form statewide partnerships in both rural and urban Colorado with the help of Colorado Department of Public Health and Environment. How does that sound to everyone? Are we still on track with what you had hoped for as far as this task force membership and overall intention?
This is Becky. I think it sounds great. My only suggestion is to remove that last part that says with the help of CDPHE, only because I think we're so much bigger than that and we're not calling out other organizations that also play key roles. So I would vote to maybe end it after Urban Colorado.
Okay.
To see what other people.
All right. How's that sound for everyone?
I think that's a great idea, Becky.
All right.
Agreed.
We will modify that. Christy, are you in the document now where you could just take it out at this time?
Yes.
Awesome. Thank you. I appreciate that. That'll make it simple so we don't overlook it. All right. So for the next few pages on here, we have been asked to go through what it is that we hope to achieve over the next year with our task force. And with a variety of input, Carlin and I synthesized these ideas into 3 goals and wanted to go over those with you today. So the first goal, and again, this is a living document, so please continue to contribute and provide ideas and recommendations for improvement, and we are happy to include them. So the first one is that we want to continue to offer educational programs during our bi-monthly meetings. And we try to do that at most every meeting like we did today. And so these are some of the other topics for future meetings that people have asked about. And essentially, this meets all of our goals to cover the topics from the cancer plan, which is identified in detail below. Goal 8.1 is around physical well-being. 8.2, mental, emotional, behavioral well-being. 8.3, patient-centered decisions. 8.4, transitions, as far as transitions through the cancer continuum for care. And 8.5, financial toxicity. So you can see some of the then detail with regard to responsibilities and due dates. If you want to scroll down just a little bit on that, you can see where we separated out the planning process. So a lot of it is led with Carlin and myself, but certainly we invite our task force members to help prioritize topics of interest for these presentations. Does anyone have any questions about that particular goal or recommendations for other topics that we could list?
Thought to consider, especially since you all only meet every other month, maybe extending the meeting time by at least half an hour to allow for sufficient time for education and sufficient time for business. I know colorectal sets their meeting time as 2 hours, but then they just don't meet the full time if they don't need to. So I think it's just something for you all to consider going forward.
All right, that's very valid. What's everyone else think about that as far as ability to attend and participate for an hour and a half if we went from 3 to 4:30 or 2:30 to 4?
And at this point too, if people want to turn on their cameras so we can feel more like we're a normal face-to-face task force meeting, I'd highly encourage you to turn your cameras on.
All right.
Maybe if we do some sort of survey in the future, we could ask that. We're grateful to people who take time out of their busy clinical schedules to join us, and so we can definitely ask others.
Okay. And I know some people had to leave early today, so we certainly can take that into consideration, and Carlin and I will also look at our schedules to see when we can best offer it. I imagine if we do extend it, it would be still on the 4th Tuesday, wouldn't you think, Carlin? To either start earlier or end later?
Yeah.
Okay. All right, well, we will definitely make that a point of consideration, and we will get back to you and let you know what makes sense for everyone in that. And we certainly will invite you to send us a message either through our survivorship at coloradocancercoalition.org email, or you can contact either one of us directly with your input or recommendations. Are there any thoughts about that right now?
Yeah, 2:30 to 4 would be just fine. Like she said, you know, we can always end early if we don't have it, but it's better that than not being able to get through all of the necessary information and touch everything or feel rushed.
Sure. Okay. Well, we'll look at our schedule. I think, yeah, right now I'm more available than Carlin is, so we'll take a look at whether that makes sense for her schedule as well. And if you all look at your schedule to check on that, that would be great too. All right, so scrolling down to the next goal, goal number 2. So in the interest of diversity and all of the discussions that have been occurring with regard to race and how we want to evaluate our own perspectives and inclusion with all groups, we included this particular goal as far as developing diversity and diverse and collaborative partnerships with at least 3 other individuals, groups, or organizations. And we listed some that we wanted to reach out to so that we could have a more inclusive coalition membership in this task force, as well as making sure that we are addressing the groups and the needs and initiatives related to cancer that are present among these groups. So these are the ones that we identified initially, and I'd like you to take a few moments to look at it and see if it is inclusive or if there are any others that we should add or modify. And as you're looking over this list as well, I'd like to hear from any of you who currently have a relationship with any of these groups and might be able to assist us in developing these collaborative partnerships.
Janice, I think that's where we struggle. We have all of these great ideas, but I think it's that relationship piece. So however we can meet people and connect with people, I think that's key.
Yes. So for those of you that are on the call today, let us know, do any of you currently have relationships or collaborations in any manner with some of these groups, or are there others that you are currently involved with that are not on this list that should be added?
Denise, can I pipe in a thought here?
Yes.
You know, as the broader coalition, this is one of our goals as well, is to make these relationships. And I think one of the things we want to do before we start reaching out is put together a, like, here's what's in it for you, and here's what we're looking for from partners. So maybe I can connect with you and Carlin on the next steering committee meeting to come up with a formalized plan on how we want to reach out. And then we can start asking for relationships and see who wants to help make introductions and be involved in those introductory meetings.
Mm-hmm. Yes, I think that's very appropriate in terms of the broader application for the coalition. I was just hoping that there were some of our members currently who already had relationships or had been involved with some of these organizations that we could at least identify now, so we knew who to reach out to when that more formal introduction occurred. But it sounds like perhaps that may not be present among the current membership who are attending this meeting, but we'll continue to reach out and try to collect that information. So any questions or concerns or modifications to this specific goal? Can I hear from anyone else on the call whether or not it's a good one, it's needs more attention? Just a sense of hearing from somebody else out there?
I think it's really inclusive.
Okay.
I think it's a really inclusive list. I think it's great.
Okay.
Are there any thoughts on wanting to add any sort of organization towards youth at all, or are we opposed to? I don't know. Are we specifically focused on adults?
Yeah, that's a fair question. I hadn't really thought about it. I think most of my care experience has been with adults, but certainly we're not opposed to that in terms of children with cancer and their families.
Mm-hmm. Just a thought.
I think from the long-term effect side, that's a good idea because they all have lots of generally long-term effects from their diagnosis.
Mm-hmm.
Point. Very good point.
And what about a specific area of the elderly population? I don't know if any of these are particular to that realm.
Good idea. I'm not aware of any specific organization that focuses on the elderly with cancer. Is anyone else aware of an organization that serves the population in that way?
I could not think of the name, but I feel like I just saw a newsletter come through for some, it's a geriatric medical association of sorts that focuses on that population. So I will do some digging and see if I can find that.
I'm most familiar with the Office on Aging. So that's what
Mhm.
comes to mind for me. Okay, we just have a few minutes left, so let's roll on down to the third goal, and we'll chat about that a little bit. So, Harlan, do you want to speak to this one?
I would like to speak to this one, yes. We basically just want to do our best to be proactive and to go forward. We want to involve as many people who want to be involved as possible. We want to think about how we can extend our reach past these meetings on the fourth Tuesday of every month. And it's an exciting time in government and policy, and we'd like to connect with people in that arena too. So I think we need to have a few more discussions to try and figure out how to do that. But certainly we look forward to connecting with colleagues in Pueblo and Grand Junction and the entire state. So however we can reach people, that's key.
Yes. Any other input from the rest of the group about this particular goal or questions?
I like this goal. I'm trying to think if there's a way to word it in a smart goal fashion of maybe attaching like a number of methods, or I'm trying to think like increase awareness by, and that's what I'm not sure what it would be like, by making 4 outreach attempts or something, or like something that we can put a number to, that we can, so I'm looking at the task, and I feel like if there's a way we can bundle those tasks into the goal, then we kind of know what we're measuring.
All right, I just wrote myself a note that we'll smarticize it.
Smarticize it, I like it. All right. Yeah, I think it's good.
Can I suggest a task for this one to consider? Since the coalition no longer does our own Survivor Day, we've been partnering with other organizations to try and help promote those and get the word out to more of those. So it'd be great to find a representative from the Survivorship Task Force that wants to sit on those, or maybe a few representatives to sit on the different ones. So I'd love for that to be considered a task here, if people agree that that's something that this task force should take on.
All right, and that I think is one of the important pieces here, is while we have quite a broad membership, sometimes it's been challenging to actually engage everyone in some of these tasks and functions. And so we really hope to hear from more folks in an active role that are willing to help us advance these goals. So that would be wonderful. All right, so keep in mind that this is our best effort so far, but it is still open to modification if you think of something later that you think would be helpful, and we will take it certainly into serious consideration and do what we can to make this action plan and achieve these goals in a very productive way. Do you mind putting up the agenda again one more time? And in the few minutes that we have left, just wanted to draw your attention to a couple things as far as the coalition quarterly meeting. Christy, that was on diversity and health disparities. That was recorded, and is that currently on the website, on the coalition website?
We actually did not record it because we wanted people to be able to speak openly.
Oh,
and
okay.
But I do have the slides and some other resources that we posted after the fact, so those can be shared, and they're posted up on the coalition's on the quarterly meeting tab on the coalition. I can insert it into the agenda after.
Oh, wonderful, thank you. And then just as a reference, there are some other resources here that you can connect with as far as the links, and then there is a new resource with regard to talk to someone, conversations about cancer, and different tools that people can use to lead those conversations and also make some sustainable changes in their life. And then we also are constantly looking for help with different activities and tasks. So if anyone is inclined to be more active in this group, we certainly want to hear from you and invite your expertise and energy and creativity as we go forward. And that might include even other ideas for speakers or topics. So please continue to reach out to us. Also, just a reminder about the virtual symposium coming up in November. Becky, is there anything you want to add on that real quickly?
It'll be November 5th and 6th. It's going to be virtual only. The focus will be cancer and COVID in Colorado. And we are not sure yet if we're offering CE credits. We're still trying to weigh the cost involved for that. But it will be free to attend for sure if you're not requesting CE credits. So it's just the CE part that we're not sure about. So mark your calendars, November 5th and 6th, and more information should be coming shortly.
Wonderful, thank you. Carlin, do you have anything else that you wanted to add before we wrap up today?
No, thank you. Just stay healthy.
Yes. Well, we really appreciate your time today. Certainly having to rush the last part is support for extending our meeting a little bit longer and having more information to share and discussion, hopefully. Is there anything for the good of the cause that anyone would like to share before we wrap up formally today? Right. Well, we graciously appreciate your time. Did I interrupt someone? Sorry.
I was just going to say thank you to everyone for engaging today and coming and participating in the task force. We're only as strong as our members and our task forces, so I'm glad to see some new faces here and some faces I recognize, and glad to see you all moving along.
Yes, yes. Thank you.
Some great books to read now. Thank you for the suggestions.
Yes, exactly. All right. Take care, everyone, and do stay well and keep in touch. Don't be far.
Thank you.
Everyone, bye.
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 Thank you.